Hello and welcome to episode 10 of Fig Friday. My name is Sharon Durnick and I'm a broker here at Frontline Insurance Group LLC. So we're going to recap everything that we've talked about so far in the past few episodes. We're going to go over pros and cons of the Medicare Advantage versus the Medicare Supplement or the Medigap policies. So I'm going to bring up some information now and share my screen with you. So let's talk a little bit about those pros and cons. So one of the pros that I like especially is with a Medicare supplement plan, you get the freedom. You have no networks at all. You don't need referrals or authorizations. As long as Medicare says yes to whatever procedure you're having done, then your supplement plan would pick up the copays, deductibles, and any co-insurance that you would have depending on the plan that you have chosen. Now, compared to the Advantage plan, you do have some networks. You have an HMO, you have a PPO option, so you can go in and out of network. But if you stay with the HMO option, you can only go to in-network. And it's based on whatever carrier, meaning Humana, Aetna, United Healthcare, whatever carrier you're choosing, you're going to be in their network for those plans. Now let's talk a little bit about payment. So Medicare supplement can be very high. Like I said, it can be $100 to $400, depending on which plan you're choosing for yourself. Medicare Advantage is very low. It could be a zero premium payment or a very low monthly payment. Medicare supplements on copays. Most of them are covered, or they're very, very limited, if any. The con is the Advantage side, which is that you do have copays when you go to a specialist, and some even charge you when you go to your primary care. Now, most Advantage plans, I do want to tell you, is a $0 premium for primary care doctor. Medicare supplements do not cover anything outside of Part A and B. So those dental, vision, hearing coverages, Part D, none of that is covered. The pro part of an Advantage plan is you get those and then some. So you get extra benefits like dental, hearing, vision, over the counter, a food benefit in some cases if you're lower income, utility allowance if you're lower income. You get a gym membership, and there is even some transportation that could be provided as well. Now, supplement policies, as far as the drug coverage, like I stated, does not cover anything. So you do have an extra monthly premium on that. With an Advantage plan, that is an advantage of that. There is no Part D premium that you have to pay for. It's all included within that plan. Now, as far as medical underwriting, now this is where it gets a little hairy-carry when it comes to a Medicare supplement plan. If you do not get it when you first turn 65, most, and I'm talking almost all states, do have medical underwriting where there's not a guaranteed acceptance if you go past when you first initially got your Part B started or when you first came on to Medicare. So whatever date you have in that Part B is when you started Part A, and then also if you delayed your Part B, it'll have a different date there. And that is your initial enrollment period dates. It's 3 months before and 3 months after that date that you do not have any type of underwriting. But if you go past that, you have to medically qualify for the plan. So depending on your diagnosis, depending on prescriptions that you've taken, or depending on if your doctor is saying that you need treatment for something, you could have a medical decline for this Medicare supplement policy. So the best bet is to get it when you turn 65 or when you become eligible for your Medicare, and that way you don't have to go through that medical underwriting process. On the other hand, the pro for Medicare Advantage is there are no health questions. At any time, any year, you can get any of the coverage. It just has, like I stated in the first video with Medicare Advantage, you have to have a special enrollment, or you have to be participating during the annual enrollment time or the general enrollment time. Those are the only time frames that you could possibly get that any of those changes to happen for you. All right, so that's the pros and cons of Medicare Advantage versus Medicare supplements. If you have any questions, concerns, or comments, please. The only way you're going to get answered right away is if you comment to this video. If you like, share, and follow this video, you can help a friend, a family member, either save money or maybe get some other coverage that they never had in the past that could be beneficial for them. So please, when it comes to reaching out to us, you can use our QR code, which is right there, that goes directly to our website, and you can schedule an appointment or just simply ask your question in the bottom portion of the website. You can also give me a call, which is right here, and that I'm at extension #800. The next episode, we will be talking a little bit more and putting everything all together and answering some questions and concerns. So it's going to be like an interactive or a question and answer type of episode for episode 11. All right, bye for now and have a wonderful week.